Hello, everyone, and welcome to OT Echo. It is February 13th, 2025, and today we have Dr. Jennifer Waid with us to talk about handwriting assessment. Kelsey has put the pre-survey link in the chat. If you could please fill out the pre-survey. And when we break out into breakout rooms, we would love to have you all turn on your cameras, please, to help facilitate that discussion. And then at the end, when we come back as a whole group, we will put the post-survey link in the chat the last 5 minutes so that you all can complete that in order to receive a certificate of attendance. Dr. Waid has said, please go ahead and enter any questions into the chat while you think of them, and I will interrupt her as she's presenting so we can keep this as informal and just really enjoy the afternoon getting some free continuing education. So thank you all so much for joining us. Thank you, Jennifer, for coming. We appreciate it.
I am excited to be here. All of you, I am very excellent at in-person teaching. I'm on the faculty at Pfeiffer University and really enjoy in-person. I am not as comfortable with online, and this is my first international presentation. So a little bit of grace and definitely like Kate was saying, if you have a question, please stop me. If I'm using a term that's unfamiliar, please stop me, ask a question, put it in the chat. However, I want to send you away today with tools that you can go out and implement immediately in your practice. So I want it to be very, very useful for you. So real quick blip about me. If my slide will forward, there we go. I've been practicing for 30 years in pediatrics here in the States, most of that in North Carolina. I am currently working as a school-based therapist, but like I said, I'm also assistant professor at Pfeiffer University, which is a very new role for me. I finished my doctorate last August and soon after that started here at Pfeiffer. So I'm enjoying the world of academia along with being still a school-based therapist as well. So we'll hop right into it because I have to say I'm used to giving presentations that are a minimum of 90 minutes. And so I've really been practicing trying to keep this in a 30-minute time frame so that we can get to the case study. Well, we will get to the case study really so we can get to all of the slides that I've created and all of the information that I would love to talk about. So in the States, handwriting is the primary reason for a referral to occupational therapy in the schools. It is the biggest reason that we see children. There are a multitude of other reasons, but when you look at the ratios, handwriting is the biggest reason for referral. So when I do a handwriting assessment, though, I take a very broad look at the child. I'm not just going to ask for a handwriting sample from the teacher. I'm not just going to watch them write. I want to look all the way from the foundational skills all the way up to that actual occupation of writing in the classroom. So today we're going to look at all of the client factors and performance skills that I include in a handwriting assessment. I'm going to also say that the first time I actually owned a standardized handwriting assessment we just bought one 6 months ago. So all of the things I'm going to show you today are informal assessment methods and do not require expensive standardized tests. You can use them, and I'll point out when they can be useful, but you definitely don't need them. Okay, so we're going to be looking, and these are all covered in the slides. We're going to be looking at upper body and core strength, how I assess those, fine motor skills, specifically handedness, grasp patterns, hand and pitch strength, in-hand manipulation skills. We're going to go over visual motor and visual perceptual skills and how those impact handwriting, oculomotor skills very briefly, sensory processing, and then, of course, handwriting. So when I am looking at upper body and core strength with a child, actually, let me take one step back. When I receive a referral, the first thing I want to do is go observe the child in their natural environment. So I'm going to go to the classroom and I'm going to hopefully step in at a time when the kids are writing. I don't always hit that moment, but I will, if a teacher's available, pull them aside, ask exactly what their concerns are, what are some other observations that they're seeing in the classroom, and then I will watch that child in whatever activity they're doing. If they're using manipulatives, what are the grasp patterns that they are using? How are they responding to the classroom environment? I'm looking at the furniture in the classroom environment, just to assess, are they the appropriate size chairs and tables? Are there alternative seating options? Those sorts of things. And then for the assessment, I do pull the child out of the classroom so that we're not a distraction and so that the child isn't distracted by what's happening in the classroom as well. So for upper body and core strength, my favorite thing to do is a wheelbarrow walk. And I don't know how familiar everybody is with a wheelbarrow walk, but essentially you take a child who's in the position that's on the slide, you get behind them and you pick up their ankles so that they are going to be walking on their hands. I love to do this because it's hands-on, but in an aspect that is absolutely safe in the school system. And you can instantly, the instant you pick up those ankles, you can feel muscle tone. You can see whether there's hyperextension in the spine, whether that spine is sagging. You can see if their scapula are winging, if they're locking their elbows to stack on those elbows in order to be able to stay up. And the instant they start to move forward, you can feel that core. Is that core nice and sturdy and supportive, or are they very wobbly? Same thing with the upper extremities. You'll see, are they collapsing at the elbows? There's a lot of clinical observations you could just do from one wheelbarrow walk. Now, I typically only do a wheelbarrow walk with kids who are kindergarten, which is 5, through maybe 10, depending on the size of the child. So that would be 5th grade for us. But if they're larger than that, or if they're a really tall kid, then I tend to go to the things next on the list. I'll watch a child hold a plank position, which is the position that she's in. Do a few push-ups. Can they do some sit-ups? Those sorts of things with older and larger kids to get a good sense of how their upper body and core strength. If you have a standardized assessment, you can do something like the Bruining-Sosaretsky or the BOT. But honestly, I still do this wheelbarrow walk or plank because there are things that I like to see that aren't necessarily covered by the standardized assessment. All right. For fine motor skills, I'm going to look at handedness, grasp patterns, hand and pinch strength, and in-hand manipulation. Now, again, if you own the BOT or the Peabody Developmental Motor Scale, they can be helpful in giving standardized numbers. I know our school system loves data. That's why I finally own a standardized handwriting assessment. But again, there tend to be holes. Neither the BOT or the PDMS assess for in-hand manipulation skills. And that's something that I find very important and is linked in research to pencil grasp and handwriting legibility. So let's talk about each of these just a little bit. So I get the question from teachers and parents all the time, especially when I'm working in preschools. He's not picking a hand. He hasn't picked a hand. Why hasn't he picked a hand, right? And so I'm very frequently giving this information to teachers and parents that children develop hand preference by age 3 or 4, but then neurological dominance doesn't happen until the age of 7. And so between those ages, 3 and 4 to 7, kids will switch hands. Kids will switch hands in the middle of a task. They'll start a task with their left hand, and then the next time they'll start it with their right hand. They're still figuring out which hand works best. Some kids will do that, not all. Within that time frame, it's really great to give kids a lot of opportunities for midline crossing, for practicing with each hand. Lefties, I have noticed 2 of my 3 kids are lefties, tend to take a little bit longer to settle on that left hand, at least again in the state's culture where there's so many people who are, it's right hand, right hand, right hand. So it just seems like it takes our lefties a little bit longer to settle on that dominant hand. When there is a question, when a child is older and they still haven't picked a hand, what I do is I do all of the things that we're going to talk about in this assessment with both hands. And I watch the quality of the movement in both hands. And a lot of times you can see a distinct difference. If they're getting past 7 and 8, I know we always hear, don't choose a hand for the child, don't choose a hand for the child. But if it's starting to interfere with functioning, I don't know, in 30 years, I think there's maybe been one maybe two instances where I actually did recommend that we go ahead and settle on the hand that had better quality of movement and really encourage the child to use that hand. Generally, it will happen naturally. All right. All right, when it comes to grasp patterns, this is what I was talking about when I go into a classroom to just observe the child in their natural environment. I'm going to be watching how are they using their hands? Are they still using a lot of fisted grasp? Well, that's fine if they well, it depends on what kind of task they're doing, right? Of course. So typically a palmar grasp is used very young, 3 to 4 months. Ulnar side, radial side is 6 to 9 months. Raking grasps come in around 5 to 9 months. Your radial digital, that one has radial digital or digital radial, 3-jaw chuck, tripod. That one has a bunch of names in the literature. It's basically your thumb and 2 fingers. That grasp comes in between 10 and 12 months, but this one sticks. We use that one for a very long time. Then we move to inferior pinch for small items and then to superior pinch for small items. And you can move again between those two depending on what object you are manipulating. So those are the types of clinical observations I do. If I didn't get to see much in the classroom, then I'll give them things to play with or I'll observe them during the activities that we're about to discuss. So for hand and pinch strength, I use pop beads. I have them here. I don't know how many of you are familiar with pop beads, but pop beads are little beads that have a ball on one end. You probably can't see me. I'm probably tiny, but that's okay. I'll hold it really close to the screen. They have a ball on one end and a hole on the other. And you push the little ball into the little hole and it makes a popping sound. You can make bracelets, you can make necklaces. Oh, and it's going in and out because of the background. Sorry. You can make bracelets, you can make necklaces, you can make snakes and caterpillars if someone doesn't want to make bracelets and necklaces. But they require resistance. So whatever toy you can think of that is popular and in your area and maybe just already in your clinic that requires 2 tripod grasps and force or because it has resistance to put together or to pull apart, those are the types of things that I would use to assess hand and pinch strength. I don't use a pinchometer or a dynamometer. I'm looking at functional tasks. More things that you can look at in the classroom. Can they get the caps off of markers? Can they put them back on and snap them? Can they get the cap off the glue? Can they rip a paper out of their notebook when they're supposed to? So can they open their lunch containers and twisting off things and pulling lids off of? So as you're watching kids perform functional tasks is another really great way to assess hand and pinch strength. Can they do those skills similarly to their peers? Oh, the rubber band on the clothespin picture. I just found that in stock images, I wanted to say, but that is a strategy that I have used in the past to increase the resistance when that goes into intervention a little bit when I'm working on pinch strength. All right. Okay. So for in-hand manipulation, let me see. Okay. So for in-hand manipulation, there are 3 different types. There is translation with stabilization, rotation with stabilization, and in-hand sorting. So translation with stabilization is when you are simply moving an object from either your fingertips and hiding it in your palm or from your palm back to your fingertips. To assess this, I use pennies. I give a child the same number of pennies as their age. So if they're 5, they get 5 pennies in their hand. And then you'll see on the next, I'm going to show a video next, hopefully it will work, of a child performing this task. But I have a little guy called Mr. Money, and a lot of therapists in the States use them. They make them out of tennis balls. You'll see him, you cut a mouth. And so they hold Mr. Money in one hand, and they hold the pennies in the other hand. And the object is to slide 1 penny at a time to the fingertips and put it in the mouth of Mr. Money without dropping any of the other pennies from the hand. This separates the 2 sides of the hand and helps assess whether the child can, in an assessment mode, can separate the 2 sides of their hand, their stability side of their hand and their mobility side of their hand. Rotation with stabilization takes it a step further. Now you're holding beads like the picture shows. You're going to roll one bead up to the fingertips, keep those other beads in the hand by closing those fingers, and rotate at the fingertips, which adds a little extra motion and makes it a little harder to keep those fingers down. Again, that assesses whether the child's going to be able to use that dynamic movement on a pencil. And then in-hand sorting, I rarely get to with kids. Usually kids with handwriting deficits have trouble with translation or rotation. In-hand sorting is the most difficult, and that's where I give them 4 beads and I say, okay, get the blue one. And they have to go in their hand and really try to use isolated finger movements and palmar arching to get the blue bead up to their fingertips and put it wherever I've asked them to put it. So let's see if I can make this video work. Here's translation with stabilization.
So the kids can see what your hands are doing. Very good.
See, he's sliding that up,
Nice.
getting it to his fingertips, and you can see that his pinky and ring finger, or finger 4 and 5, are curled around the pennies. Oh,
uh-oh. Mr. Money dropped it.
Curled around those other pennies. See all those isolated finger movements,
Good.
and then the separation of the 2 sides of the hand. All right. Oh,
so the kids.
There we go. Okay. So once I've done all the motor assessments, then I'm going to start looking, well, now it's visual motor integration. For pencil control, I'll give a child a very short little narrow pathway to guide their pencil through. I have them draw a person. I have them do some design copying. If you have the VMI or the TVMS, those are great standardized design copying assessments, but you definitely don't have to have those. You can follow kind of the developmental progression of those shapes, you know, vertical line, horizontal line, circle, and move through the developmental progression and see which ones the child has difficulty with. I'm just noticing my time, so I'm going to pick up the pace just a little bit. But if I'm going too fast, stop me with a question. So the next thing you really want to take into consideration are visual perceptual skills. As you watch the child write, there's the 7 different visual perceptual skills. These are all tested specifically by the TVPS and most of them by the MVPT. But I look at them again functionally. So visual discrimination helps them know B versus D or an A versus a G. All of these, I won't go through every single one. I just feel it's very important that as you watch a child write, you're also considering visual perception. Oculomotor skills is a little bit of an area of controversy in OT. I know it's very important that we stay within our scope, but I also need to know, is this child seeing accurately? In order to work on handwriting, we need to know that they are seeing properly. So as far as I do a quick screening of convergence. I use a object depending on their age, you know, something that's interesting to them that they can look at up close. I literally have popsicle sticks with little animal heads drawn on each end, or smiley faces, or emoji stickers, something that I can bring close and see. Is there any asymmetry when they're trying to look at an object up close and when they're following it going away? Can they follow an object as it moves around in their visual field? Does a teacher report that they skip lines or skip words? Is there any indication of difficulty with saccades? Now, when I find issues in these areas, I refer to an optometrist, because a developmental optometrist is the one who's going to be able to fully assess and treat these things. If you're trained as an occupational therapist, then that's a different story as well, but that's a whole different workshop. Okay, finally, I'm looking at sensory processing. I've had kids who keep their wrist elevated when they write because they don't like the feel of dragging their hand across the paper. There are kids reporting pain when they write. Are they distracted by the sound of the pencil on the paper, or the chalk on the chalkboard, or any auditory distractions in the environment? I'm looking at how are they able to sit upright? What's their postural control like? And is it a proprioceptive issue? When they pull up under a table, do they lose their legs and fall out of their chair because they don't have good body awareness? These are the sorts of things that I'm looking at when it comes to sensory processing and writing. And then finally, I'm getting the handwriting sample. It's one of the last things I actually do. So during the handwriting sample, I'm looking at posture. I'm looking at how are they holding their wrist and what does their grasp look like? I'm looking at the sample. What does the legibility look like as they are writing? How are they forming the letters? Are they using segmented construction, which is like ball and stick construction? Are they using reverse construction, which means they're starting at the writing line and going up instead of coming down to the writing line? I'm looking at how they're sizing their letters, their spacing within and between words, and their alignment on the writing line. And I'm taking all of that into account through the lens of also visual perception, oculomotor, and sensory processing. Now, in order to do a really great handwriting sample, of course, the four things you really want to make sure that you attend to are making sure the child does have good posture. They're in a seat that's the right size for them, at a table that's the right size for them. You want to make sure they're on the proper paper that they're familiar with lines, or the lines they're familiar with. So in kindergarten, our kids use the 3-line paper, a top line, a bottom line, and a middle dotted line. And I use that paper for a handwriting sample up through 1st grade. And then it depends in 2nd grade what their class is using, because in 2nd grade, they transition to notebook paper. And then in 3rd and 4th grade, they only use notebook paper. So I'm going to assess their handwriting on the paper that they're the most familiar with. And then, of course, you want to make sure that the task you're asking them to do is a task that is fairly simple. So either it's most of the time I do copying from a near point copying right next to them, or I may do a far point copy off of the board. I might do both of those depending on what the teacher's concerns are. And then I'll usually have them try to generate something themselves based on their grade level. A kindergartner might only write 1 or 2 words for me, and a 5th grader, I might ask them to write 3 sentences from their own thoughts. Okay, so posture, obviously I was thrilled to find this on stock images. So here we can see that her feet are not supported. The seat is too deep and she's having to lean over to reach that table. And then in the other picture, you can see that they've put a support under her feet. So her ankles can be at 90 degrees, her knees are at 90 degrees, her hips are at 90 degrees, and she's showing a much better posture in that right hand picture. As far as wrist and grasp, you want to make sure that you want to watch to see whether the wrist is in slight extension. That's what would be ideal. But a lot of kids hold their wrist in neutral and even flexion position, which is lifting that arm up off of the table, especially if they're still using a static tripod grasp. So here, you see this is the developmental progression, or a developmental progression of grasp patterns. And so when a child is a year to a year and a half, this fisted grasp is absolutely typical. That's what we would expect, but not at 5. And then your digital pronate is around 2 to 3 years old. Not all kids go through this one. Some skip it. A 4-finger grasp or a quadrupod grasp, again, sometimes never occurs, but it is typical around the age of 3 to 4, as is a static tripod grasp. And then dynamic tripod, you're looking for that around the age of 4, so 4 and up. Now, that is, of course, the gold standard, but recent research has shown us that there are 4 functional grasp patterns. And I did put this reference in the back at the end of the slides. But this shows us that these 4 grasp patterns are considered functional. And I still get requests where teachers will say, will you come look at this grasp pattern? And I'll come into the classroom and take a look. And if it's one of these 4, and if there's no pain, if the child does not report any pain or excessive fatigue when they write, and their handwriting is legible, then it is considered a functional grasp. All right. And then these are some of the pictures of some of the kids in my handwriting group, actually. And these are the grasps that we are working on improving. These are non-functional grasps. So this first one at the top is a fisted grasp, and he even tucks his thumb in there and guides his pencil entirely with finger 4, or finger 5, sorry. Well, a 4 moves a little bit, mostly 5. This one with the vertical pencil and the pencil's not lying back in the web space. The second from I just realized I'm not pointing on the right screen. Can you see? I don't know if you can see my cursor now or not, but when that pencil is upright and isn't laying back in the web space, that pink pen, that causes a lot of difficulty with the child, A, not being able to see the writing line, and then it causes issues with drag and accuracy. Oh, someone wrote on that. I don't know if you guys can see that or not. There's writing on that.
We
Okay.
did. Sorry about that.
Oh, no, it's okay. I just saw it. All right. This next one, what you can see here is a really hyperextended index DIP, or distal interphalangeal joint there, and that causes this child a lot of pain. So well, and this is going into intervention, which I'm going to talk about next month, but that one is we're going to put a pencil grip on there and do some exercises to try to strengthen the muscles around that joint. So you can see as you look through these, this last one, the bottom right, that extreme hyperextension again in that thumb IP joint, and that causes that child also a lot of pain. So I just realized that my time was the time from when I started sharing. So I might have zoomed through and didn't really need to. How am I doing on time? What is
You have 5 minutes.
Oh, I'm doing perfect on time. Good. I might end this just a little bit early, actually. We can get to our case study. Perfect. Okay. So this is just a small example of some of the non-functional pencil grasp patterns that I've seen in my handwriting groups. Now, I'm going to go back to this one real quick on the top. Here we go. On the top left. This is a little guy who can assume and use a very pretty dynamic tripod grasp. However, he much prefers this grasp. Now, his handwriting is equally legible and equally fast, and he reports no pain using this grasp. Usually this is not the case, by the way, but he has developed an excellent skill with this. So I would usually pose the question, I don't know if I would get it, but I would pose the question to my students in class, is that then a functional grasp?
That is a great question. And there's also another question in the chat if you all want to answer that question
Sure.
while Dr. Waid answers this one. So the question is, does vertical writing help improve the non-functional grasp into a functional grasp?
Yes, sometimes it definitely does. And that will definitely be something that we're speaking about. I had such a hard time, I have to say, separating out assessment and intervention. Usually when I talk about handwriting, I talk about the two of them together. But in order to make it be 30 minutes, I decided to do them separately. So I've been really having to sit on my hands, shut my mouth. I don't know what I wanted to go into intervention. But yes, getting children on a vertical surface is excellent for multiple reasons. It gets that wrist in that extended position and definitely helps bring out that the separation of the two sides of the hand and that dynamic tripod or even quadrupod grasp, one of the functional grasps. However, I've still even seen kids who are in one of these fisted positions on a vertical surface still will use that fisted grasp. So, but we will definitely talk about these things more next month. So come on back next month to the handwriting intervention workshop.
So I have two more questions. One of them is, how would a shoulder impairment impact handwriting?
So it's going to depend on, technically, as long as the child is supported in a nice upright posture, the shoulder should not be involved in handwriting very much. By the time you get to a nice dynamic tripod grasp, you are resting your forearm on the writing surface, and it's mostly a finger movement. Beyond being able to slide, it's going to depend. Can they slide their arm across the table, depending on their shoulder impairment? That would be the biggest thing, would be sliding that arm, because you're stabilizing at the forearm, which then reduces how much movement you really need in your shoulder. I would probably have to see the shoulder impairment.
We have another case study question. So one of the autistic children holds a crayon tightly but loose when holding a pencil. What could be the reason and the intervention for this?
Wow. So my mind went straight to sensory, right? Because when you think about a crayon, it's got that soft paper on the outside, it's fully rounded, and it would be nice and smooth and easy to hold. But then the pencil, especially if it's one of the ones that's angled, like these yellow ones in my examples, they're, what is that, hexagonal, I think? I think it's six-sided. So they have the corners on them and they're wood and they're not nearly as comfy as a crayon. So I'm actually wondering, the first thing I would probably do is A, try a round pencil, and then B, see if I could just something simple like a foam pencil grip to kind of cover up the hard surface of the pencil might change how that's happening. Try, my wheels are turning. That would be the first, that was the first thing that jumped in my head. So that would be the first thing that I would try. And then if that doesn't work, if changing the texture of the writing tool itself doesn't work, then I would have to start thinking of the next step.
Great, thank you.
Sure. Okay, I think I have one more. So this is our first, I was just going to talk through this one. So this is Ryan. He's a 9-year-old who is in one of my handwriting groups. He is on grade level for math and for reading. He's a very in touch kid. He loves science and he can talk about a lot of topics in great detail. He would definitely fit the criteria for developmental motor coordination disorder, though he has not been diagnosed with that formally. If you're looking at this handwriting sample and going, what on earth? Those little caret or upside down V marks are a grading. They're supposed to connect say whether the two words that are next to each other connect. So I like, and then like Roblox because those all go together. That's what those, so ignore the carets. Those aren't necessary for it. I made those, not him. But for legibility, I wanted you to take a look at this because in here you can see, I don't know if I can see, I don't know if you can see my arrow or not, but you can see some reverse construction where he comes down with the B, but then he goes back up. You can see the segmented construction in here with the H where he's got two separate lines. And then you can obviously also see that he has a lot of difficulty with size consistency and with just visual spatial relations in general. Well, falling off the end of the line instead of stopping and going to the next line. He is a student who we've worked really, really hard. You can see it a little bit, but not, he's so much improved by this point. His margin used to float. So he would start on the left and write the first line, but then he would start on the second line about an inch from the left, and then about 2 inches from the left, and then about 3 inches from the left. So he had this diagonal line instead of having a nice straight margin. So he definitely, and you can see that his pencil pressure is very, very heavy. This is a kid who really wants his handwriting to improve because he can see the differences in his and his peers' handwriting, and he's made so many gains. But I just wanted to look at that through those different lenses and how I'm looking at not just how I'm looking at legibility through the different lenses, like I said, as far as how he forms his letters, so legibility factors, visual perception being visual spatial relations issues. Oculomotor used to be how that margin would go diagonal. And then sensory wise, he has very, very heavy pressure, which relates back to that developmental motor coordination disorder. And that lack of awareness of body and space. Okay, so I'm landing, this is the case study. Are we good timing for the case study?
This is great. I have one last question though before you get going on that. The question is, some children keep leaning on the table while writing, and this influences their functional writing grasp pattern. If this is entirely developmental, how can it be handled?
Well, I would question it if it is developmental. So the first thing I think when I'm hearing that kids are really leaning on the table is that very first thing that we talked about, postural control, core strength and upper body strength. So do they have the postural stability to stay nice and upright and their bodies away from the table so that they can hold the paper with a hand, with their non-preferred hand, and then do the writing with their preferred hand? And if they don't have the core strength to have that nice upright posture, then there's multiple things that I would do. I would start working on core strength, but that's going to take a long time. So in the classroom setting, at least my school is a very flexible school. My teachers are very flexible. I would actually ask in the beginning, and I would watch to see if it works first, but I would ask in the beginning, can the child lay on their belly with a clipboard in front of them to do their writing so that they can have their core totally supported and not have to worry about staying up on the table and feeling like they have to lean. Or in a figuring out, could they do their writing in a bean bag so their core is totally on, again, on a clipboard, and that would put that clipboard on a vertical and would potentially get their hand in the right position. Now they'd have to be able to hold that clipboard with the other hand. So there's a lot of, it's hard. I would love to see the a picture of what the child looks like, and then I would want to see them in different alternative writing positions. That's probably one of the first things I would try with them. Is it better if they're on their bellies? Is it better if they're in a supported seating like a beanbag chair? And can they hold their clipboard while writing in that position? Yeah.
Great, thank you.
Sure.
You are free to take away the case study, and then any questions we'll get to at the end. How's that?
Okay, sounds great. Okay, so this is Grayson. He's another one of my kids in handwriting group. He is 7.5 years old, and he was referred for occupational therapy screening due to his teacher's concerns about his handwriting legibility. Grayson's teacher describes him as a bright student who is on grade level for reading and math. And the reason I brought both of these case studies is because neither of these children have IEPs or individualized education plans. That is primarily how kids in the States access OT in the school system, is with an IEP. So kids who don't have an IEP, there's limited options depending on the school. And so a lot of kids, research has shown us, and I don't think I have this research. This is from my dissertation, so I don't think I have this reference in the back of in the slides, but I can give it to you. Research has shown that up to 27% of kids in US schools have handwriting deficits, but a tiny fraction of those kids actually receive occupational therapy. So these two kids are kids who wouldn't have received occupational therapy intervention had it not been for my school's willingness to have me get involved in what's called the multi-tiered system of support, which is MTSS, which allows me to give handwriting groups or classes to kids who don't have IEPs, but who have difficulty with handwriting. So he reportedly struggles with body awareness and often, quote, gets in other students' space. Grayson is unable to zip his own coat when getting ready for recess or dismissal. He has difficulty opening his lunch containers and requires help removing lids from markers and glue during classroom activities. So that gives you some clues into his the client factors and performance skills that impact his handwriting. And then next slide shows his handwriting sample. And it breaks my heart what he wrote. If you can read it, it says, "I want good writing." This was on one of the first days of handwriting group. So what we're going to do, you know what? I don't know if did I put the questions on here? I did not put the questions on here. Well, I put the whole case study, but I didn't put the questions. So let me switch to, I'm going to stop sharing this really quick, and I'm going to go grab those questions for you. It should also be in a document that I think some of you could have uploaded.
Yes, all of your PowerPoint slides and the case study is uploaded to the OT Echo site. And I'll actually put our website in the chat. So all of the recordings from all of our meetings are also on our website. So I'll go ahead and put that in the chat. And while Jennifer is pulling up the questions, just as a reminder, when we go into the breakout rooms in just a couple minutes, please remember to leave your cameras on. It really helps with the discussion.
Okay, let's see if I can do this really quick. So now, where's my share? Oh, I made this small. I'm gonna have to make you big. Let's see if I can do it. I'm not sure how this is going to show. Let's see what happens. I'm going to go ahead and share it and see if tell me if those questions pop up or not.
Yes, we can see them.
Okay, wonderful.
You just got to slide them a little bit over to the...
Okay, what happens if I do this? Did that help it at all?
Yeah, that's fine.
Okay. I'm not sure what I did. Okay, so anyway, you guys, having those, hopefully you'll be able to keep those slides. But this is, again, this is a full document. So it actually shows it shows us the pictures and everything. But go ahead and discuss what are your hypotheses about which performance skills and client factors are impacting Grayson's handwriting skills. Describe what you notice about Grayson's pencil grasp and what this indicates. And then describe what you notice about Grayson's handwriting, which aspects of legibility are challenging for Grayson.
Great, thank you. And Joel also put the questions in the chat for everyone. Thank you for doing that. And Kelsey is now going to open up the rooms and you will all go to your breakout rooms. Thank you, everyone. And remember to leave your cameras on, please. Great. Thank you, everyone, and welcome back. We're going to get started with the first question, which was, what are your hypotheses about which performance skills and client factors are impacting Grayson's handwriting skills? Adonis, do you want to tell us how your group answered that?
Well, I'll give my turn to Evidence and welcome her as a facilitator in our group.
I'm sorry, Adonis, did you say someone else was going to speak for your group?
Yeah, I would welcome Evidence to speak for this question.
Oh, okay. Sorry, my line was muted and I was talking. So we talked about motor planning, and also fine motor skills, his strengths, and his perception skills, having more being more aware of body and space, and also his hand strength. And since there were issues with him fixing his zippers, so the fine motor skills and strength and perception. Thank you.
Great, thank you. Timothy, did your group have anything else to add?
Yes, Kate, our group had something to add. We talked about the reduced strength, which was affecting Grayson's handwriting. And then we also talked about the visual memory. Then another thing we mentioned was bilateral coordination.
Great, thank you. Talu, what about your group? Did you have anything extra?
Yeah, we mentioned about the strengths, the dexterity, there was also someone mentioned about the idiomatic access and which also the pull pressure, the pull pencil pressure was also something that we discussed. That the grasp was a bit too tight. I think that's the only, and then someone also mentioned about a sensory processing issue, which is perceptive, or the possibility of sensory processing challenges. That's the addition to what's been mentioned earlier.
Great, thank you. Eunice, could you tell us about question 2? Describe what you notice about Grayson's pencil grasp and what this indicates. Is Eunice still here? No, I don't see a mic kicked off. Smanzer, do you want to answer for your group?
Right. We spoke about the fact that the very positioning of it would hinder his visual motor skill application in the writing space. And of course, that would not even, he would not be able to see what he's writing. And then the fact that the very hold or grasp looks like he's using lots of pressure. Yeah. And even that, what was it? In the handwriting piece that we were shown later, you could see that the handwriting kept, the pressure was fluctuating. At one moment, it was quite oppressed, then the next, not so much. So modulation was a bit, yeah, of a thing. And then the hyperextension of the index finger, and then the fact that even the pencil itself is sort of pressed up on the palm. It takes the whole hand to write this. So maybe we thought along the lines of it being a weakness in hand strength that he was compensating for.
Great, thank you. And we just have 2 minutes left for the last question, but please, the post survey is in the chat. If you wanted to complete that, you need to actually do that to get a certificate of attendance, but you can just copy the link now and complete the survey later. Just for the last question, I'm sorry to rush it. David, but do you want to tell us about your group? Describe what you noticed about Grayson's handwriting. Which aspects of legibility are challenging for Grayson?
Our group found he had difficulty with both vertical and horizontal spacing, spacing between words and staying on the lines. Also, difficulty with closure. Some of the O's were not closed. Difficulty differentiating between uppercase and lowercase letters. Those are most of the things we noticed.
Great, thank you so much. All right, well, I just want to say thank you so much to everyone for coming today. I think today was the highest attendance that we've had for a meeting yet. So thank you, everyone. Thank you, Jennifer, volunteering your time. And Jennifer's going to be here next month with us to do handwriting interventions. And Kelsey and Adonis, our awesome team members, are going to be facilitating because Sarah and I are going to be at a meeting. So see you all next month.